Hi, everyone. Thank you for joining the Health and Wellbeing Innovation Practice Group. It's great to have you here. Let's first go through a bit of technicalities and the agenda, and then we'll do an icebreaker before getting into the topic. So just a few technical considerations. Please keep in mind that you should keep your microphone muted when people are presenting and when you're not speaking, but unmute whenever you want to contribute. Also, please turn on your camera so we can see you. It's much nicer to see a person than a black screen. And use all the Zoom functions that are available. So you can raise your hand if you want to speak. You can also use the reactions if you want to react to something. Use the chat if you have any questions while we have the presentations going. And also, please rename your Zoom name. So you can add your name and the region that you're coming from and the organization. Next slide, please. Then about today's agenda. So today we are going to do a quick icebreaker to get into the topic. Then we have a presentation from a Pathways to Resilience region in Umbria, Italy. Then we will have a plenary discussion. Unfortunately, the expert that was supposed to join us has a sick child, so won't be able to participate, but we'll have a discussion amongst ourselves. And then we will kind of take key takeaways that emerge from the discussion. And then we have a quick feedback survey about the session, if you could fill it out. Next slide, please. So for the icebreaker, I would ask you all to open your chats and answer to the questions that appear on the screen, but don't press paste until I give you the signal. So I'll give you about half a minute to answer each question, and then we can you can paste it in the chat and then I'll read it out. So the first question is, what is your name and where are you connecting from? So the location you're connecting from. So this is an easy one. I'll just maybe give you a bit less than half a minute. Yeah, so if you could please now paste where you're coming from. So we've got Lucio from Italy. We've got Bojana from Serbia, Jan from Normandy, Lucia from Italy, Holly from London, Mariana from Serbia, Maria from Slovenia. We've got Marcel from Chile, Nicola from Croatia, Luciana from Romania. Then we've got Sweden, Italy again, and Stefano from Italy. Okay, thank you all. Next question, please, Marcel. And Salvatore, our presenter from Italy as well. So next question, what's the weather like outside where you're from? Please put your answers in the chat. And while you wait, I'm going to tell you that in Serbia, it's getting hot and we're already getting our first heat wave as a nice beginning to June. So it's been 30 degrees and it's going to get to 36 around the country. Sunny and hot, very hot, sunny and warm. Okay, I can see that we have a theme going on here. Sunny and fresh, that's a bit nicer. Cloudy, that's Normandy. Okay, it's not hot everywhere, I guess. Rainy, windy, and cold. Well, it's winter in Chile, right, Marcel? So that makes sense. Just stopped raining. Very hot. Hot 30 degrees, second day of real summer. Luciana, we can feel that from Serbia as well. Sunny and fresh. I think, Sylvia, you have it the best, probably. Best of both worlds. Next question, please. So this one is just getting us a bit into the headspace around this innovation practice group. So we would like you to name one way in which you see that climate is affecting health in the place you live. So what health impacts have you noticed that are being brought by climate change? I'll give you around half a minute again, and then maybe you could start pasting it in the chat. Okay, if your answers are ready, you can start having them roll in. Summer heat waves, because there's no culture of risk, it's an emerging threat. We can see that in Serbia as well. Summer heat is long and unbearable. Heat waves. Heat problems because of the heat. Dehydration collapses. Excess deaths in more frequent heat waves, mostly flooding, so drinking water getting contaminated, and fires in the woods. Sunburns just when walking on the streets. Drought has increased wildfire frequency. Super hot weather creates issues with blood pressure, feeling tired and exhausted. So I think the most common one we have is heat and issues with heat waves and the health consequences of heat waves, but then also flooding and wildfires. So I believe these are all topics that we'll touch on in this session. Thank you for this icebreaker, everyone. And just another note, one more note before I pass on to Marcel. Next slide, please, Marcel. Is that we're gonna have the cartoonist is unfortunately unable to join the session in person, but what we're doing is recording the session, and then after it's finished, we will have Betche, a cartoonist, listen to it and draft some cartoons as outputs. We've collaborated with her before within this project, and we've got really nice and interesting outputs. Here are two examples from two sessions. One is on behavioral change. So this cartoon is representing how daunting changing behaviors can be. And the second cartoon you can see on your right is a session we had on knowledge and data, and how what data says matters in terms of one's perception. So the person living on the top floor doesn't think that there'll be a flood risk, while the person living on the bottom floor is quite concerned. So we will share with you these cartoons that emerge from this session around end of June, and then you can also use it within your presentations or wherever you see fit. Over to you, Marcel.
Thank you very much, Anka, and nice to see all of you here. My name is Marcelo Goyenete, and I work at the Red Cross Climate Center. As we dive into today's subject around this IPG on health and well-being, I just would like to recap for those of you who might join us again for a second time, or those of you who are joining us for the first time, exactly what the IPGs are, or more specifically, the innovation practice groups. These are part of the larger capacity strengthening work done within the P2R project, and they're really a moment to learn and share knowledge among groups, and that this is really, and for this to be guided really by the region challenges and needs, and it's really an instance for regions to review and refine ideas, look at plans, look at solutions, learn from each other in a way that is not really found in other capacity strengthening moments. So it's really an instance where we can showcase best practices. We can start the creation of new plans and ideas. It might spark something among you while you listen to the case study that will be presented today. You might have expertise that you want to share with us after the presentation. It's just in general an instance for us to sort of broaden a bit our perspectives in a very non-committal way. So it allows us to connect regions with sources of knowledge and expertise. It allows us to create communities around adaptation practitioners in Europe, and it provides an additional knowledge and exchange opportunity. As I mentioned, this is the second IPG week out of a total of 3 weeks. that will be that the IPGs will be offered, and following this IPG, we'll have IPG number 3, and then that with that the first cohort will finish, and we'll have a session that will be a bridge between you and the cohort that will come afterwards. Now, what we discuss here is really important for us to capture and build upon and kind of create a knowledge continuity. It's not just a one-off event. And the way we do that is we have a Miro. Again, those of you who have joined the first one know this Miro. So now we have an additional canvas open on there for us to capture some of the ideas. I'm going to share in a little while the link to this Miro, and it will give us an opportunity either to capture ideas, but also for you to access some of the resources and information that is available. So with that, let's go into what today's IPG is about. And it's really, so we're featuring the experience from Umbria, Italy. And I want to, first of all, express my sincere gratitude to the region for volunteering to present this case study. I think it's a really, really nice initiative. And I think it's also a nice reminder to all of us that everyone is able to contribute through these IPGs. So small plug for IPG week number 3. Now that if you want to get more involved, we always welcome that. So for Umbria, this case study really revolves around their health prevention plan, and specifically health data and health information that was collected through this plan, and how this information could be used to inform the development of a climate adaptation strategy that includes health. So it really is an IPG that tries to sort of explore how can we bridge sectoral vulnerabilities with climate risk and early action and others. And with us, so just a brief map on where exactly is Umbria, in case you haven't yet Googled it, a quick help to locate it on the map. And with us today, we have Dr. Stefano Briganti. He's the head of Heritage and International Projects at 3A Umbria Agri-Food Technology Park, Umbria. He's a graduate in political science and works in the field of agriculture, agri-food, and environment. He has over 20 years of work experience in international cooperation and local development projects, and he's currently the coordinator of Umbria Region Team P2R URAC project. With him, we have Salvatore Macri. He is a graduate in veterinary medicine, PhD in inspection of food and of animal origin. He has work experience in the Italian Ministry of Health, the Italian and European Medicines Agency, and is currently the head of the Prevention, Veterinary Health and Food Hygiene Services of Umbria Region, and he is the responsible for the Umbria Prevention Plan One Health. With that, I'm going to stop sharing and I'm going to pass the floor over to Dr. Macri.
Presentation. Good afternoon.
Good afternoon, we can hear you.
Can you see the presentation?
Yes.
Okay. Good afternoon at all. I will describe the prevention plan to you in a very concise way, and any question send me on my email, is on the last of the presentation. Slide. The regional plan of prevention is a part of national health plan focused on health promotion and prevention. Regional prevention plan based on national guidelines evaluated at the national level to specific indicator and timelines. The prevention plan, this is important, this slide. The prevention plan is an essential level of care, and LEL is a set of healthcare service and benefit that the National Health Service must provide to all citizens, either free or charge or with a co-payment in the national territory. There are the vision of the plan. They are the principal of the plan. One health approach by setting and life course, gender approach and equity. One health is a goal very important, is in the very plain, international very plain. And One Health as the result of harmonious and sustainable development of human, nature and environment. Is very important this because Agenda 2030 was goals are considered in the regional plan. Another important approach is the life course approach. Preventive, protective or curative intervention carried out promptly in the very early stages of life lead to positive health outcome that last a lifetime and also impact future generation and the entire community. Another approach is the setting approach. The PMP Prevention National Plan aims to improve the setting-based approach by promoting greater interaction among all settings, school, workplace, community, healthcare service, and the local authorities is the super setting. There are more or less the index of the plan. The important action of the plan are cross-cutting action and specifically the training and the communication, central action, macro objective are non-communicable chronic disease, addictions and related issues, road and domestic accident, work-related injuries and accident, and occupational disease, environment and health, priority infection disease. Let's see them one by one in brief. Training is aimed at developing new skills, counseling, urban health, and the training is also essential to strengthen in intersectoral collaboration and to effectively implement the One Health principle. For the communication, is important to promote health-friendly behaviors, encouraging changes in social norms, improve access to and participation in prevention and care programs, and foster active. Another object is the non-communicable chronic disease. Non-communicable chronic disease, the management of requires a multidisciplinary approach with a wide range of coordinated intervention at different levels to prevent their onset, ensure early care for individuals at risk or in the initial stages, and slow down disease progression, including through behavioral intervention. Additional and related issues, institutional commitment should focus on promoting intervention programs that reduce risk factor and strengthen protective factor. However, this responsibility cannot be solely delegated to the social health care system department of prevention. It's essential to involve and coordinate all institutional, cultural and social, regional and local level to ensure a comprehensive intervention system that synergizes all available resources. Domestic accidents to address domestic injuries. Multi-level strategies required, involving all relevant healthcare services through integrated prevention actions and target interventions. Road accident prevention requires a multi-sectoral approach and the involvement of institutions. Example include enhancing local public transport, urban planning, and securing home-to-school routes. Work injuries and accident, occupational disease. The plan emphasizes the strategic need to address the entire complex system of various actors involved in workplace health and safety prevention policies. Environment, climate and health, the strategic guideline. The first promote advocacy intervention in the policy of other sector, environment, transport, construction, urban planning. The second, promote and strengthen tools to facilitate the integration and the synergy between the prevention service of the national health care and the agency of the national system for environment protection. And three, implement intervention to prevent and reduce environment exposures, indoor, outdoor, and anthropogenic factor harmful to health. For the priority infection disease, it's important to improving surveillance activities, organizing for infection emergency, developing both prevention action and emergency preparedness, strengthening and improving monitoring of vaccination coverage, enhancing prevention intervention, communication aimed at the population and training for healthcare workers. The last slide for the governance of the prevention plan. The plan is coordination group, which in addition to coordinating the drafting activities, will also be maintained for the implementation of program and related control and monitoring. The macro objective reference responsible for verify the coverage of all strategic objective. The program reference who, supported by a specific working group, are responsible for drafting the program and planning the activities. Thank you for attention. This is my mail for any question.
Thank you very much for this presentation. I know this is very coupled to the presentation which will be now delivered by Dr. Stefano Briganti. So I'll hand over the microphone to you.
Okay, here I am. Let me put my presentation. Sorry for the technical problem. Okay, I want only to tell that I'm very happy not only to be here, but also about the participation of two real experts that are from different field, not directly expert on a healthy system, but in my opinion, very important for this discussion, that are Enzo Faloci, as I told to Marcel and the other guys from P2R. He is a very important expert on international project. And also Dr. Paolo Stranieri, that is an expert coming from regional agency for environmental protection, and he is cooperating with our agency since a lot of years on biodiversity conservation and valorization. So I think that they can give good support to our discussion. So thanks to them. Okay. As you know, we are one of the regions selected in the first call of P2R program, and that is the name of our project. Very easy, the output, because we are working on creation of strategy and action plan in the field of adaptation to climate change. I will not have more than 3-4 slides because we don't have so much time, but that is the most.
So
Yeah,
oh, okay. Sorry. There you go.
that is the most important slide. Why? Because I will try to explain our strategy. So, as I told, our goal is to create and do participation, public participation of about the Umbria Regional Adaptation to Climate Change Program. How we worked? We was happy and we was also lucky to have adopted in 2023 our strategy for sustainable development. That is a very important starting point because as I'm showing in that image, we don't have only a logo, but we have a group, a working group. As you could see, the strategy, in the strategy preparation worked university, worked UNICEF, worked the other association of the territory, worked, of course, the regional agency for environmental protection, other consultants. And that is very important because there, so 2-3 years ago, we did not only a participation inside the institutional parts of our region, but we did also a public participation involving all association of entrepreneurs, association of farmers, association of third sector, for example, association, and also moving in the territory to explain what was our strategy. That is very important because it gave us not only the base to start to work on adaptation to climate change, but also because it gave us, gave us a way to work. So for us, it's not so strange to work in joining different people, different stakeholders. So starting from the strategy for sustainable development, we did an investment, a real investment, also financial investment, using other kind of funding, so not P2R, but funds coming from European Regional Development Fund. And we produced what is one of the pillar to build a climate change strategy, that is the climate scenario analysis. So we used consultants and innovative softwares to to create some scenario in the short, medium, and long period. That is, I'm not a technician, but also I understood, not being a technician, I also understood that that is the most important part to create a real plan and a real strategy for adaptation to climate change. After that, with the result of the climate scenario, we started to use what we already have as the sectoral analysis coming from Umbria Region Prevention Plan. And then we move to the other directorates of Umbria Region. We did first in plenaria meeting, and then we did one by one meetings to give some specific information. We created some schedules that the directorates with our assistants fulfill. And so we worked really everywhere. So both the Directorate for Human Resources, Culture, Digital Agenda, and the Directorate that is working on environment, the Directorate that is working in agriculture and local development, but also education, training, and also sport and tourism. The result of all this participation inside Umbria region will be, because it's not ended, will be the Umbria region adaptation to climate change. In that moment, we will do, in the last part of the project, we will do also a public participation. That will be not only participation, but mostly, in my opinion, need to be communication. Because which is one of the limits that I saw during the first month of this project, is that, and I'm very sorry about it, is that when you talk to people about climate change and the needs to adapt our territories to climate change, it is a lot of resistance. People don't understand, don't want to understand, sometimes deny what is happening, and that is a big problem, because when you need, and we will need, to allocate resources, economic resources, financial resources on this topic, we will find some obstacles. That is, in my opinion, one interesting topic to discuss a little later, because we know that are there climatic changes, we know that are there effects on health and public health system, but it's not easy to explain and to convince people about the fact that we need to put financial resources to mitigate and to resist to this changement, also changing some behaviors. That is very, very difficult, in my opinion, according to my experience. On the same time, I think that is very difficult also for P2R to understand what is happening in these projects, because the differences between territories are very, very big. Of course, it's not the same when you talk with the municipality of Big London, or when you talk with the Umbria region or Marche region, or when you talk do an example because I met them 1 month ago when you talk with really a municipality in Serbia. Because are different dimensions, different territories, also different political and institutional level. Okay, I don't want to annoy you. I will only show how we worked using the thematic of a healthy system. So that are the result, the first result of the work that we did with the Umbria Region Health Directorate. So we concentrated our meetings to first to analyze the current situation in which emerge clearly how the increasing of extreme weather events are vehicles of spread of zoonotic pathogens and other illness. After that, we tried to define what are the critical issues, and for sure, we concentrated in the vulnerabilities that are already present and also about the risks that that are occurring in our territories. So it's clear, because we already have experience, that we have the diffusion of some diseases transmitted by not European vectors, for example, the West Nile insects, but also other. We have a big risk of microbiological and chemical risks in food chain, because of course the changing of temperature and also the quality and the water resources can be contaminated. We have another problem, more or less spread everywhere in Europe, but in Italy and in our region is very big problem. So the increasing of the vulnerable population, especially elderly part, and also isolated rural areas population, because our territory is on average hills and high hills territory, so it's very easy to find a group of people, a little group of people that lives in marginal areas. And of course, so as critical issues, it was individuated how is important to do any kind of effort to have investments in environmental and climate data prevision. And that is something that we are working on. We will write in our strategy. Okay, it's not all a critical situation, because the last part of our survey with the direction of the Directorate of Health let emerge that we have some ongoing adaptation actions, especially that one related to climate warning systems. Climate warning systems now, thanks to the technology, is very, very important issue, because more or less we don't have immediate solution to stop the climate change, but we can anticipate the disasters that can be a little less disaster for our territory. And how to do, of course, through the integration of forecasting systems with veterinary surveillance systems. And that is very important, of course, not only to anticipate zoonotic infectious, but also to create a sort of group of experts that can work together, search solution together, support together also at political and institutional level all action that can benefit our environment. Okay, only to finish, I'm showing which is our idea to create also thematic schedules to share with the population. That is one image related to environmental change and healthy system situation that describe how is important to study the adaptive capacity, because really we don't know at the moment how we will be able to adapt ourselves. So it's very important in our scenario activity, it's very important to anticipate the situation and to try to understand which are the level of vulnerability. Of course, vulnerability depends from a group of people to group of people. Of course, elder generation and young generation are for sure more exposed to this kind of vulnerability. But okay, it was only to show how we try to get near our population in our region. I talk too much, so I stop.
Thank you very much. Thank you very much both for this very interesting presentation, and especially for this insight that you just shared. And I would like with this now for us to go into the next segment of this IPG, which is really about reflecting around what was just shared. And we're going to do that in 2 steps. The first one is I'm going to share a mirror, and then I'm going to be quiet for around 7 minutes, just to give you time to go through Miro, have a look at the questions there. And if something comes up for you to write it down. And after those 7 minutes, I'm going to unmute myself. I'm going to invite you to share your microphone and we can have a discussion. So let me share just very briefly what it is that you will find on the Miro. So I believe you see my screen. You will see we have 4 topics listed here. I'm not going to go through each of them. I just want you to see what it is that, we have. So you have 4 topics: the health sector as a catalyst, promoting pro-resilience behaviors and community engagement, climate resilience for active aging, integrating health and well-being strategies, co-developing integrated health, climate, early warning systems for proactive response, and leveraging regional health data and prevention plans for climate adaptation. And you have a couple of questions there, and I would invite you to just freely roam around these questions, and if anything triggers a particular thought, you have here post-its. You can take these and write down your idea. And with that, I'm going to put in the chat the link right now. Just give me 1 moment if I find the chat.
I put it's there.
So, okay, fantastic. Thank you very much. I'm going to put on some music for those who like it. For those who don't, you just unmute, but then pay attention when I start speaking again so you can rejoin. And with that, let's spend some 7 minutes on this. Very good. Well, with that, thank you very much for your contributions. I think there were a number of interesting ideas shared on the Miro. Some of you are still on there. So with that, I would like to open the floor for anybody who would like to take the microphone and share a few ideas to do so. Or Stefano, if you would like to call up on somebody you would like to hear from, please do. Just unmute the microphone. Go ahead.
Okay. Okay, I will introduce.
Please go ahead.
No, okay, I worked a little on topic 4, and okay, it arrived. I didn't have time to see who wrote. It arrived a note related to progressive salinization of coastal areas. That is not a problem of Umbria region, of course, because we don't have the sea. But I understand, of course, the problem, and especially because salinization of coastal areas doesn't mean only potential increasing of pathogens, but also because it put out a lot of agricultural land and pollution on water. And the problem is more evident as this guy, I don't remember the name, wrote, if and when the territory is populated to mainly to elder generation, because of the capacity of reaction and the capacity of the adaptation is of course lower. On the contrary, I put two topic, two notes. One is related to the experience of Umbria region with our rural development plan on funding chain innovation project. So we use these funds to oblige in some way agricultural production and processing part of production to work together to individuate and prototypize innovation in their systems. Work together was very important. Okay, we obliged a little to have money, but it was very important experience, because in that way we could understand better how to put together problem of different part of the production chain. Otherwise, sometimes you realize a problem of one side, but it's strange, but can happen that the problem you solve the problem in one side, but you increase the problem of the other part of production. Working together means find together solution that can solve the problem to the entire chain of production. The other topic is about biodiversity. Is a topic that we are very proud in our region to follow since I think 15 years for sure. Why? Because especially in this period of strong climate changes, to save and to understand how to valorize autochthonous genetic resources is very important, because that genetic resources risk to get lost first, and it is lost, but that production, that varieties, that genetic resources resisted in that territories because of their genetic profile. And that profile can be very useful in the next future, because if there existed not having a production value, it means that the capacity of resistance to differences climate situation is very strong. So tomorrow can become really a possibility of surviving for the production of some marginal areas.
Okay, thank you very much. Anybody who would like to react to that or add something different or just share a question? Jan, you look like you're thinking of something to ask.
No, I was just thinking about the fact that we are also very concerned in Normandy about new species that are arriving due to the increasing temperature, and so this has an impact on both agriculture and also on health, because of the dissemination of pollens and new health diseases. We are a bit we are looking at this, and this is one of our major challenges, and it makes a link between agriculture and health as well. Yeah, I was just thinking about that.
Indeed, it's one of the changing patterns that we've seen, and I'm probably trying to understand what the consequences or the repercussions of that are going to be down the line. Yes, thank you. Anybody else? What are your thoughts around the way how Uber is approaching the development of the strategy as such? Because one thing is, of course, okay, what the conclusion is of the climate change adaptation strategy. Another thing is, okay, how are we going about developing these strategies? And of course, this will be different from place to place. May you have a thought around the process as such, and what you think might be a takeaway for you as to how your region could go about this? Or okay,
If I may, I have a question.
yes,
In fact, I was wondering in your region how many institutions are responsible for coordinating around health, because in our territory we have the problem that the state is very important, and then we have regional authorities that are lacking a bit power. And for instance, if we want to do a adaptation strategy with a strong focus on health, we will be lacking the political powers to implement it. And so I was wondering, in your case, how you are coordinating with the different institutions to make this work.
I don't know if Salvatore Macri is still online.
No, I don't think he is.
Okay. No, because he is the person that is more able than me for sure to answer. What I can tell, I don't know the situation of the institutional level involved in Normandy. What is our situation? Our levels are, of course, we have a national level, but each Italian region has autonomy in the management and organization and programming of healthy system. Of course, usually the only problem is capacity of investment. That is more or less normal. But we did in the last period, I mean in the last 20 years, not so recently, we did, in my opinion, a smart investment, and it is to reduce the number of hospitals, because we had the problem that each 20,000 people had an hospital. That was a big problem because of course, capacity of spending money, but also because of specialization. If you have in a little region like Umbria, less than 1 million inhabitants, too many hospitals, you risk not to have a good level of services. So what we did, we reduced the number of hospitals, creating specialization in less number of hospitals, and then we invested in what we call territory health. So we prefer to use personnel, for example, to move personnel from healthy system to the houses of people that have some injuries, not only because they cannot move, but because it's very easier and less expensive to move personnel to people, and on the contrary, is very expensive to guest people in public structures. So that is one example of how we are trying to organize in a different way the healthy system, thanks to the fact that, as I told, in Italy, the regions have autonomy to organize the service.
Did that answer your question, Jan?
Yes.
Fantastic.
Thank you very much.
In
Anybody
each case,
else?
we are near. You can come to meet us, and we will show. You are not so far.
Nicola, please go ahead.
Yes, I would like to ask Mr. Briganti. You told us that you have initial problem with people denying the climate change, and that's something that we also experience here. I'm a researcher from Croatia. We work for our neighboring country, Bosnia and Herzegovina, and looks like it is a common point of view. But if we are, it is a very interesting plan, very detailed, and if we are to apply something like your plan or your program of work, can you tell us, can you share your experience? Which other obstacles did you find during your work? So you could make it easier to us your experience besides denial, you know.
No, as I told, we had the advantage that we did in the recent period. We did the strategy for sustainable development. So in that moment, we had really a large experience in participation, more or less in each territory. So according to that experiences, as I told, we preferred to write before the strategy, climate adaptation strategy, and then to do a large communication plan. Because if we go in the territories and talk with the people, even if organized, associated, most of them will not understand why we are using public money to do that. That is really a big problem, not only because of lack of scientific approach. Also, I don't have a scientific approach, but people need to be informed not from a technical point of view because they don't understand, mostly of them. They need to understand from experts that the climate is really changing and that are not only investment strategy, that is for sure important part, but it is also necessary to change some behaviors of citizens. As I told 1 month ago, I was in Arilje in Serbia. Arilje is the most important Balkan in all Western Balkan places for production of forest fruits. They sell everywhere in Europe. They are forest fruits. Each year they have flooding. Each year with a lot of damages. Okay, when you talk with the farmers, they don't want to talk about climate change. They are not interested to climate change. They are interested how and where you will invest to avoid the flooding. So that is a behavioral change that we need to talk with people to try to inform and to communicate, because it will be not enough investments to solve problems coming from weather conditions and changes. We need to let them understand that we need to adopt a resilience strategy, change some behaviors, because if we don't adapt to the different and changing condition, it will be not enough investments to return to the condition of some decades ago. That is my opinion, of course.
Thank you very much. We are coming slowly to the end of this session. And to cap off, Stefano, could I ask you if you would to give other regions one recommendation, other regions that are engaged and are also interested or working on the climate change adaptation plan, what would be the one recommendation that you would give them as to how to make the best of that process?
That is not so easy to answer. I think that is my idea. I think that it's very important to have a solid base of data, because without data, you can only imagine. Data now are very, very important. Are important for the future, are important also for the present. If you don't have data, you cannot, for example, push in the acceleration of introduction of innovation in agriculture. Now, I'm talking about agriculture because it's the field that I know better. In agriculture, you have a lot of innovation that can contrast weather condition changing. So data are the base, in my opinion. So a good climate scenario can be very, very strategic and very, very important to search solution, because in our project we need to do not only a strategy, so not only lead the climate change from a political and institutional point of view, but we need to find to write an action plan, so to think about investments to do. So in my opinion, the base are data. Without data, you cannot interpret anything.
Can I
Fantastic.
give my little contribution?
Go ahead, Enzo.
In my personal experience, one recommendation is to work with the young generation, because the difficult to accept the climate change for old generation is clear, no? Because you have to change your life, you have to change your history, so you have to use a long-term, medium-term strategy point of view. The young generation are more resilient in these ways. So the information, the data, the policy, the real transformation of the context of climate is the future of the young generation. So I think that the society have to work hardly with the young generation. In my experience, recent experience, I organized a survey with 500 young students of about 18, 19 years old around the green transition. Inside there were also questions about the climate change. My experience is that this young generation are ready to change the behavior, to improve to the quality of behavior in respect of the problem of climate change. So I think, this is my personal opinion, that many of the efforts has to be oriented to inform the young generation. The future is there.
Thank you very much, Enzo. I think that is a very meaningful message that you're passing there, and that might be just as a good opportunity to plug another IPG that will happen tomorrow afternoon around behavioral change and empowerment. I think the subject of youth is definitely something that has some space there. With that, I want to thank you for your contributions to Stefano, as well as to Dr. Macri. And I would like for you to respond a little survey that we have prepared. It's going to take you very, very short. It's going to pop up as part of this call. There it is now. It's just a few questions for you to give us a feedback, because this is really something that we use to go back to the drawing board and think about our next IPG. Very good. And with that, very good. With that, I want to thank all of you for joining today. Thank you very much to UMI Region for coming forward with this case study. I think it was very, very interesting. And I do want to remind you, we still have a few IPGs for this week: land use and food systems, and the behavioral change and empowerment I was mentioning earlier for tomorrow. On Thursday, knowledge and data. Friday, ecosystems and nature-based solutions, and Friday, governance, engagement, and collaboration. With that, thank you very much, and I wish you an excellent rest of the day.
Thank you.
Sure.
Very much.
Bye-bye.